All right. Good morning, everybody. Welcome to Xyrus and Dental Voice. My name is Rolando Mia. The purpose of our session here is to give people and listeners an opportunity to hear from clinicians, to hear from experts, and to hear from people who are dealing with everything that our industry is dealing with today. Today we have a special guest. We've got Dr. David Bonner, who is dentist that we've been working with and an incredibly knowledgeable person around the space. What we're going to do during the course of this session is talk about education. But before I begin, I just want to say Dr. Bonner is an adjunct professor at University of Texas in, Dental School, Health Dental School in San Antonio. He also has an MBA. He's a lecturing doctor and has a really strong understanding of the business and underpinnings of dentistry. In addition, he's also been one of our elected officials in Texas. So he's got an incredible breadth of information and understanding, and I'm really looking forward to hearing from him. Good morning, Dr. Bonner. How are you, sir?
Good morning. Doing terrific.
Awesome. So when you look at what's happening, typically we would be talking about different things in dentistry. And right now, a huge issue is the crisis that we're dealing with and this pandemic, COVID-19 and all of that type of stuff. How are you? How is that affecting you? What's happening with you and your practice and your family and all?
Well, I practice with my son, and we just opened up a new dental office about 3 months before all of this hit. So it was certainly different. And I think we're all going to get through it. It's not a good thing that's happening to our country, but officials and researchers are working hard to get us through it. And I think things are going to be fine when it's all said and done. So. And I'll also add this. I mentioned earlier before we started that when I lecture on the business side of dentistry, I mentioned to dentists that we don't sometimes realize that with just the stroke of a governor's pen, things can change. And that has happened now, and I'm sorry that it has, but it's truly affected everyone.
Well, I appreciate that. And, it's interesting. I speak with a lot of clinicians, and there's a huge amount of uncertainty that's going on right now. And especially given that the practices are basically shut down except for emergency procedures. For dentists who are kind of stressing about that right now, what advice would you give about, how to, I love the message about we will get through this, but what advice would you give to clinicians right now who are feeling, that anxiety, that stress?
Well, what we need to do is to work on things we have control over. And we don't have a lot of control over this and when we're going to be able to get back to complete and full operation. But, I'm always an optimistic individual and look at what can I do to make lemonade out of lemons. And so I have never been off more than 2 weeks. And it was a rare occasion that I took a 2-week vacation. This is the 4th week that I'm not been working. My son's taking care of the emergencies. And so there's a lot of things that I've been doing and preparing for, and I think we can make productive use of our time. And so we're not happy about it, but we can make it the best thing possible for it.
Oh, very much appreciate that. And I agree. We've been hearing a lot of things. One of the biggest or something that comes up often, and it's interesting, is because a lot of the clinicians are currently not working other than dealing with or performing emergency procedures is education. And we've had several talking about it. You see a lot of talk about taking the time to educate now that you have the time. What are your thoughts on that? And what would mean taking the time to educate now that you have the time?
Well, it's a great question. And I think education is the key to success, especially in dental practices. And it's one of the things that we have been doing. There's a lot of seminars that are very inexpensive. Some have actually been free. I've been attending several. The Texas Dental Association has an annual convention the very first part of May, and that's been canceled because of this coronavirus situation. And do continuing education courses at the dental school. Dr. Scott Stafford is in charge of continuing education there, and excited about what he has decided to put together. We have put together somewhat of an alternative dental meeting. So a lot of dentists were counting on the Texas Dental Association meeting for their continuing education credits. And what we've been able to do is put together a 2-day meeting. It's going to start this week on Thursday and Friday. And there'll be at least 11 speakers, 3-hour meetings. Some speakers will do 2 3-hour segments. And we're only charging $28 for each 3-hour segments, which is pretty close to free.
That's awesome.
Yeah, and so I'm speaking Thursday morning, and there are a number of excellent speakers that are speaking throughout those 2 days. So you'll have choices. There'll be speakers that'll be on, obviously different segments, but there'll be several speakers Thursday morning, several Thursday afternoon. The same thing goes on Friday. And so there's a lot of great speakers that are lined up for this meeting.
So when you're looking at sessions like this, or when you're looking at educational forums, what are some of the things that clinicians should be looking for when they're evaluating the courses that they should be taking, or, especially since everything now is being done online and as opposed to, in person or hands-on, what are some of the things that people should be looking for when they're thinking about courses? Because you mentioned that some of these are free, some of these, and the cost is nominal, which is wonderful. So you can get your CE. So what would some of those things be?
Well, one fundamental thing is, will your state board use or accept these meetings for credit? And in Texas, and I think it's true of a lot of states, one of the things that's critical is that it be where you can have live interaction. And when you have live interaction, our state board considers that a live course, even though it's done over the internet. And so with this meeting, what we're going to do is we're going to have it where people can interact. They'll be able to submit questions. We'll answer those questions. And I think that's an important thing, because it's not just listening to someone lecture and your questions may or may not be answered.
Yeah.
So it makes it a better meeting when you can ask questions, but it also is important to know, will your state board accept these hours as credit? And so I think that's the first thing you want to look at to make sure you're making wise use of your time. And there are a number of meetings that are doing that sort of thing. I attended some last week that were exactly that way.
And then, so it sounds so very important that when or if clinicians are looking at participating in these courses, you want to make sure that they will be recognized. Otherwise, it's just taking time to go listen to somebody. And it sounds like the interactive part is really important, because it gives you that dynamic of being able to challenge, to ask questions, and all that.
Yeah, and I'm not saying that you can't learn a lot from a meeting where there's not interaction, but I think it's important to have interaction, so it will be accepted as credit, and so that you can have even a greater learning experience. And so that's the first thing I would suggest. There's also, I think, the need to constantly evaluate, where am I weak? What do I need to do? And to make myself a stronger dentist, a stronger business person, and to be able to serve my patients in the very best way possible. There's a third, and there are always those areas that we have to do, in order to be licensed, to meet the requirements of our regulatory bodies. And so those courses, those educational pursuits are sometimes a little less exciting. So what I'm saying is, this is a good time to say, hey, I've got extra time. Maybe I need to reread the rules and regulations the state board makes me do. Our state board has a regular course that you get online, you have to take every so often. Nobody looks forward to having to do that, but it's important. And so this is a good time to do that. So, well, I've got nothing better to do from time to time, and I think I'll just take care of that. And so there's some courses that you can do that are kind of have-tos that you can take care of. And it's a good time to review ethics I'm a member of the American College of Dentists, and we have a great emphasis on promoting ethics in dentistry. And sometimes that seems like a subject people are not as interested in, but when we revisit that, we realize it really is important, and it helps us better serve our patients.
Oh, I love that. I love that. And so it's accreditation. Where am I weak, or what are the areas that I would like to improve or enhance my abilities? And then the third one is that's the first time I've heard that, which is there are requirements that you have to get to, that you have to deal with, that you're just required to do, that you would not as attractive, and it's a great time to get that. Is that what I'm hearing, Dr. Bonner?
Yeah, that's exactly right. And then there's always those books that we'd like to read, but when do you have the time? Because you're busy working at your office, you come home, you're tired, and you go, well, I don't know if I have time tonight to read that book. And yet this is a great time to catch up on some reading that'll actually do us all a lot of good. And that's one of the things when I went through my MBA program with Texas Tech University, we read and we read. And they were all books that anyone could access. They weren't dry, boring university textbooks. They were great books that really had lasting value. And so I think that books like that it's a good time to be able to re-engage with those, to read them, to maybe get on Audible and to listen to them.
That's a great idea. I appreciate that very much. And definitely. Now, you work with a dental school, and one of the issues, one of the topics that's been coming up is, for first and second years, it's mostly didactic in class. But for the third and the fourth year students, there's a clinical aspect of it that, because of the quarantine that we're dealing globally, they're not able to treat, or they're not able to physically work with patients. What advice would you give them, or how would you have, especially fourth years who are, they need to get those cases in to get the experience into it? How would you suggest they look at that, and what kind of feedback would you give them?
Well, that's a challenging question, and we've looked at that. Me not personally involved at the dental school on that issue, but there's doctors like Dr. Stafford and others that are at the dental school looking at that, trying to help the students. And one of the questions has been, how are they going to be able to take their regional board exams? Yeah. Because a lot of regional board exams have been on live patients. So there's been discussion, can they take those board exams on non-live patients? In other words, on a mannequin, a dentiform, and be able to do that. And a lot of good can be done by practicing your preparation, your other techniques on inanimate forms. And so I would encourage dental students to be reviewing their knowledge, to be thinking about the future, to think about their business plans, who they're going to go to work with, or are they going to start up their own practice. That's not as often done anymore, but it's certainly something that's viable. And it gives students a time when they're in school. They don't have a lot of time to think about a lot of their options because they're so busy fulfilling their requirements with patients and their education. But here's a little time to sit back and go, okay, what do I really want to do?
So is it even feasible to do? Because there's been talk of maybe pushing out or accelerating from a Texas and from the dental school that you're working with. You have students who are in that space? Is there what in addition to looking at that, what else can they do to kind of keep their, I guess it's the hands-on piece up to snuff, I guess?
Yeah, working on patients is not going to happen until the president and the governor make a decision to let that happen. So that area is just out. But there are ways to be able to, at our dental school, it's a very modern school, and I think a lot of schools are like this, where they can actually mount in a head a dentiform where you can do preparations. Not as exciting as working on a patient, not as challenging as working on a patient, but it's good to be able to keep your skills going. I know when I was in dental school and in the first few years I was out, I'd take a week vacation first few years I was out. You'd come back after 1 week, is like, wow. It's like you'd been gone a month, and you'd feel like, in effect, your knowledge almost. You didn't forget anything, but it almost affected that. And now after you practice 40 years, you can take off a month, and it's going to be like going back to what you've always done. But I really empathize with our dental students. They're the future of dentistry, and actually they're the present of dentistry. And so there's not a lot of great options, but I think that's one of the better options they may have.
Yeah, and I like the context, which is even though it's not a live patient, still take the time to actually work your craft, because even on a dentiform or a typodont or any of that type of thing, you're still having to work through, and this way you have at least the experience of actually using the instruments and all. Did I catch that correctly?
Absolutely. And I think there's also things that dental students sometimes do not have the time for, like continuing education courses. I mean, I teach continuing education courses in dental schools, and sometimes dental students will attend those. This is a time where dental students can pursue education that they're interested in that they may not have gotten as much of in dental school. And, beefing up their knowledge of implant dentistry. Maybe they're interested in doing orthodontics, doing endodontics. There's one of the sad things is in dental schools today compared to many years ago is there's not as much, not as many patients available to do procedures. And so when I was in dental school, there was no telling how many root canals we had done when we graduated. And they're not doing as many root canals as students. And one of the things that I really appreciate dental schools are doing is when they really promote the dental students in their undergrad years to really pursue a lot of these procedures. And this is a time where you can do that. I mean, extracted teeth, and there's other ways of working on root canals. And so I think this is a good time to go, hey, where am I weak? Where do I want to be stronger?
I love the message. Where am I weak? Where do I want to be stronger? Let's go focus on that. Now, let me ask you, I'm also seeing, in addition to the courses, the CE courses that are being given by like your state associations or as adjuncts or schools, a lot of the manufacturers are providing education. From your perspective, how do you see, or is there a difference between the kind of courses that you're seeing that are done in the educational side or with the schools and associations versus the education that you see from manufacturers? What's the difference?
It kind of depends on the manufacturer. There's some manufacturers that are putting out some excellent courses. There's some manufacturers that are hurting so much, they just really kind of pulled back, and they're not spending the money they could spend in providing speakers. Now, I want to tell you something. That's what I think is an interesting aside. This dental meeting that we're putting on for Texas, but people out of state are certainly welcome to enroll. Every speaker is speaking for free. I'm not being paid. No speaker's being paid. We have all waived our compensation. You typically give a speaker a fairly decent honorarium, right? And we're all like, hey, we understand dentists are hurting because they're not receiving active income that they're earning. And so this is a great way to do our dental profession a favor. I don't think most dentists are very giving along that way. And so, this is an opportunity to be able to do that. And some manufacturers are involved in doing continuing education this way. Some are not. So I think you can get good education from manufacturers, but you can also perhaps get less biased information sometimes in a dental association meeting or from a dental school, where you may mention certain products, manufacturers, but you also have some guidelines on how you do that.
That's awesome. I love the fact that the clinicians are kind of coming together and giving their time to the state association, the Texas Associate, to kind of offset. All of the courses, all of the trade shows have been canceled, and there's there were a lot of courses that were given during those, and they're excellent. And where do you get them? So the fact that you're coming together to do that, and you're doing it as a value to the population is wonderful, and really very much appreciate that. I mean, education is gold. It's funny. It's sometimes you kind of take it for granted, and then all of a sudden you realize how important it is. So that's awesome. So thanks for that.
I'll tell you, I got out of dental school in 1980, and there was a lot of fantastic dentists that were great mentors. And one of the things that they taught me was we are a brotherhood, a sisterhood, a family, and we really help each other. We're not really in competition as much. And I know sometimes with a little different emphasis on business and how business is done in dentistry, things have changed somewhat. But I really think that dentists, as a rule, are very caring people, and they're wanting to do whatever they can do to help each other and also help the population receive dental services.
Yeah, that's awesome. That's awesome. So I'm going to shift gears slightly. During this crisis, one of the biggest issues that we've been hearing about is the dangers of aerosols, the dangers of droplets of spatter, and there's almost a fear because people people have masks, people have all sorts of things. Even when we're allowed to come back in, there's still going to be this issue of aerosols, of spatter, of splatter. What are your thoughts with regard to how to deal with that and this whole, this entirely, completely new focus or much higher focus on infection control? What are your thoughts on that?
That's a fantastic question. It's one that's dear to my heart, but I want to preface it with this. Zyrus Dental has never been a sponsor of mine. Okay? So it's a totally unbiased opinion. Yeah, I've had corporate sponsors in different venues, and you and I have never reached out and created a relationship like that. But I'm going to tell you one of the things I talk about in just about every clinical course I do is how you can use an Isolite to answer some of these questions. But I want to tell you a little bit of my story. I went to a dental convention and I'd been interested in the Isolite products. And I know the name has changed. The Zyrus Dental is the name of the company, but it's still the Isolite product. And I was interested in it. I saw what I thought it would do. And so I bought 3 of the setups to bring back to my office. We put them in, and then I did exactly what a lot of dentists do. I didn't use it. Oh. And we sometimes laugh about that. How many dentists?
I wasn't expecting that.
No. How many dentists buy equipment and instrumentation and then they don't use it? How many times have you bought an articulator that it went into the closets you didn't actually use? And that's been the conversation in dentistry for years about how most dentists, if they have any age at all on them, have a closet full of stuff that they've not used.
Right.
So we have it set up. I'm not using it. I have a busy practice. And so my son's working with me. My son said, "Dad, why aren't you using the Isolite?" And I said, "Well, I just don't have time to slow down and put it into action." And he said, "Dad, it's so simple. Why don't you use it?" And so I said, "Okay, I'm going to do it." And then you look at all the different options of the mouthpieces, and so you look at that and you go, "Wow, which one do you use?" And it looked like it was, you count on, what do y'all have, 7?
Yeah, 7 sizes, yeah.
7 sizes. So you go, okay, I've got a patient. They're all different sizes. Which one do I use? And that was kind of daunting because I'm not wanting to use one, throw it away, pick up another one, throw it away, pick up a third one. And then I realized after I used it a few times that almost every adult, a medium DV, a medium deep vestibule fits. Even people who could be better used with a large. Even people that need just a medium, you pick up a pair of scissors and in 30 seconds it's been customized where it goes in. And so that was a thing that really was my obstacle. That was my obstacle that kept me from using the Isolite, is I didn't want to waste a whole lot of mouthpieces. And then I realized, you know what, this is super simple. And on most children, I use a small. Oh, I know you have a pedo size, but most children can open their mouth extremely wide. And so a small works, and sometimes a medium, and if you've had a little experience, you realize which one you're going to use. And so those are really about the 3 sizes that I use primarily, and with adults is primarily medium DV. So I got past that. And then there was the next thing. How are people going to accept this? Because, they're not used to it. And, you're putting something that appears to be large in their mouth. And I thought, well, you need to present this from the patient's point of view. And so I would show them the mouthpiece, and I said, have we ever used one of these on you before? And at first, the answer is obviously no, but it was a way to introduce the subject. And I would say, it's a super soft mouthpiece that it does a lot of great things for you. What it's going to do is it's going to keep your cheek, your lip, your tongue out of the way to protect them. It's also going to remove all the saliva and water out of your mouth. And you're going to be able to lean back, and you're going to be able to just literally go to sleep if you want to. You don't have to, but a lot of people do. And so most people were accepting it, and that kind of surprised me. In fact, when I say most, it's rare that someone doesn't accept it. It's a rare week when someone won't accept it. It really is. And so I started using it. And then the real test was when my daughter, and I think she was about 35 at the time, my older daughter came in, and she's always the kind of individual wants things a certain way. And I respect that. You go to her house and it is immaculate. Everything is in place. It's perfect. And she has the way she wants to do things. And it's great. So I'm thinking to myself, okay, is my daughter going to accept this? So I just presented it as I do to everyone, and I put it in. And then I did the work on her, and then I took it out, and I didn't ask her anything. I sat her up, and she immediately and spontaneously turned around and said, "Dad, that was awesome."
Well, that's great.
And I said, "Are you kidding me?" And she's, "No, that was awesome. I love that." And so that was really kind of, in my way, a mental testifier, where I saw that and I go, wow, that really shows me something, even though I've been using this for a while. And then I want to tell one on my son, because my son, I've had some areas where I chipped some teeth and he was going to do some bonding on them. And he looked at me and he says, "Dad, do you want to use the Isolite?" And I think he thought I was going to say no. And I didn't ever really ask him, so that may be presumption that's wrong. But I looked at him and I said, "Well, of course. I want to use the Isolite." And so he put it in. And as he was working on my teeth, I literally fell asleep because I didn't have to relax. And you know what the deal is from the dental point of view, we've all had these conversations. You're not using an Isolite or a rubber dam, and you work on the patient. You say, "Could you open? Could you open, please? Could you open bigger? Now, I mean, really wide this time. Could you keep it open?" And you say that for the entire 30 or 40-minute procedure. And I got so tired of saying that. And it's even though I'm kind of a talker, you might be able to tell, I got where it was just silent in the treatment rooms, listen to the music, working on them, because you don't have to keep telling people. And I know from a patient point of view, they don't want to hear that. They get tired of the dentist asking them incessantly to open their mouth larger. And so, it was a convenience. And then I began to do some time motion studies, and I began to realize that with most adults, I was saving at least 30% of the time, which is great for the patient. Patient doesn't want to be there any longer, and they have to. No matter how pleasant you make it, this is not entertainment for most patients. Now, I got to tell you, I walk in the treatment room every day. Patients look at me, and I go, "Hey, you ready to have fun?" And they go, "What? Fun?" And I go, "Yeah, we're ready to have fun. I think dentistry ought to be fun." And what I mean by that is this: if it can be a pleasant experience, as opposed to what a lot of people think it's going to be, when it's all said and done, you walk out and go, "Well, that wasn't unpleasant, and I expected unpleasant. Therefore, in a way, it's fun." And so, I guess I'm a character, but I ask people all the time, I say, "You ready to have fun?"
You want to have fun.
Yeah.
Now, have you seen the effect that, or how it deals with, or this whole aerosol thing is a big issue right now.
Oh, absolutely.
Splatter, all that type of stuff. Have you, or what are some of the things that you want that are important with regard to the procedures?
No, and that's what your original question was. Hey, I was about to get there, and I'm glad you asked it again. But no, that's a great question, because when we're all concerned about infection control, and we should have always been concerned about infection control. I mean, I'll go back to the 1980s before AIDS had really come out in the early 1980s, or an understanding of it anyway. We had hepatitis B, And there's a certain number of people who are infected with hepatitis B that become carriers and never get over it. And yet in dental skills, what were they teaching us? Be barehanded. Don't wear gloves. Be barehanded unless you're doing surgery. Well, you could do a prophylaxis on a patient and have more blood in your hands in some surgeries. And so we should have always been wearing gloves. But AIDS comes out. It's a terrible thing, but it taught us something. It taught us to wear gloves. And then somewhere along the line, everybody realized, you know what, we need to wear safety glasses to keep the splatter out of our eyes. And if you've ever seen anybody that's had, a herpes simplex infection of the eyes, it'll make a believer out of you wearing safety glasses. And so all along, we should have been wearing safety glasses and masks and wearing gloves. And so there's always been a need for something like an Isolite. Well, hey, originally it was called a rubber dam. And a rubber dam is great. I still use rubber dams for endodontics. But I love an Isolite for a number of reasons. It is a great way to prevent an aerosol. In fact, what surprised me is when I read a study recently that showed that the Isolite actually is better at controlling an aerosol than a rubber dam. Now, I know that's probably hard for a lot of people to believe, but there's a scientific study out there where they've shown that seems to be true. Now, when you're doing bonding on composites, you need to control the environment for what you're bonding. And with the controlled humidity in the mouth, you're going to get better bonding. The same way when you're putting on crowns, you're going to have a better bonding of the crown, and the crown's going to stay on. But if you don't control that, you've got a problem. So it affects dentistry. But coming back to your question, it's a great way to have great infection control by helping prevent this aerosol. You think about this, the mouthpiece for an Isolite goes back and it blocks the mouth. It keeps the cheek out of the way, it keeps the tongue back. So it extremely minimizes how much saliva is in the mouth. But as important, or maybe more important than all that, there's this continuous full mouth suction going on. Now, I want to break away for just a second and tell you one of the things I experience with my patients when they've never used an Isolite is I'll tell them, I say, you need to breathe through your nose because it has such a strong suction that when you're not experienced to this, then it may feel like it's taking your breath away. So I'll put it in their mouth and I'll turn it on. First, I always ask people all the time, you doing all right? You okay? And then every once in a while, you can just see in their eyes that, hey, I'm not able to breathe, or at least they think that. And so I take it out right away. Don't make a big deal out of it. So just get your breath, relax. You're doing what most people do. Reassure them and then put it back in. And, usually the second time they're great. And that is not happening very often, but it happens with some. The point is, though, is this suction is tremendous. And, if you're tired of having saliva in the face, I was. I don't like having saliva in the face. And, and bless their hearts, dental assistants do the very best job they possibly can. They have a high volume evacuator. They've got an air water syringe. But it's impossible not to every once in a while spray the dentist. And that spray a lot of times is reflected off the surface that they're spraying on. So what do you want to be in that surface? Very minimal bacterial load and viral load, or do you want it to be full of bacteria and viruses? Well, for us, the Isolite was a great option. And I use rubber dams a lot. But I use rubber dams now more exclusively than endodontics, and I use Isolite for everything else. Now, I'll tell you, there's a great infection control aspect of this, but there's also convenience. There's been times where my dental assistants, and we have several in our office, but they'd be tied up doing things, and I wanted to get started. I'll put an Isolite in and done surgery. Well, and I got to tell you, Rolando, I don't know if anybody else calls it this, but when I'm doing my presentation, I talk about Isolite. I call it the dental assistant in a box. Dental assistant box. It does not replace your dental assistant, but it makes her job a lot easier. I say her, there's guy dental assistants as well. I don't want to sound like I'm gender specific.
No, thank you. Appreciate that, and really appreciate the story, and thank you for sharing that. We've definitely heard that, and I think it's important, especially now, given that there's such a high awareness around that, and patients, there's this fear that I don't want to infect my team. I want to make sure I'm doing everything I can, and I think that's really helpful. So thank you for sharing that. Very much appreciate that. So just shifting gears real quick here, and you're going to be doing a session, Joy of Dentistry, during the course, and that's going to be done over this weekend. And very much appreciate you sharing the context around finding courses or finding education to help you with things that you want to deal with, but also the things that you have to deal with. And I like that. Where would someone get more information with regard to kind of the sessions that you're doing, and also, if they wanted to have, or if they had questions that they'd like to ask you or reach out to you, what would be the best thing to do?
Well, I will tell you, if you want to reach out to me, my email address is the easiest way to contact me. It's simple. It's Dr. David Bonner, as in Dr. David Bonner. No dots in there, just Dr. David Bonner. Dr. David Bonner at gmail.com. And if you're interested in the virtual dental meeting, whether it's to listen to me or another one of the great speakers, then there's a simple way to do it. Just Google UT Health, and it'll bring up the Health Science Center. When you bring that up, it'll also, you'll have all the different schools, School of Dentistry. Go down to that, click on it on the upper left-hand side. You'll see academics, click on that. And then on the upper left-hand side, you will see continuing education on the School of Dentistry. And it'll take you right to it. There's a banner that scrolls across the top, and you'll see the very first thing, the virtual dental meeting. Now, if you don't mind, I'll hold up a little sign that'll kind of give you the address of this. So it's a UT Health, School of Dentistry, and it's at smile.uthscsa.edu. The UTHSCSA is the old name of the dental school, University of Texas Health Science Center, San Antonio. And there's my email address as well, Dr. David Bonner. And you're certainly free to call me. I'm here to help. And I'm also, you'll notice on that website, I'm doing a live seminar at the dental school, unless it gets canceled by the governor at the end of the month in May. And I do a number of lectures. This one's called Grand Slam Restorative Dentistry. It's a 7-hour course.
Oh, wow. Awesome. So for people who will be viewing this later, and those who are still with us, thank you for being on there. If you have any questions, please, we can answer that. But what kind of final words or closing words would you like to give folks regarding this and what we've been talking about, and kind of your thoughts on, getting through all of this?
We're talking to the dental community, and the dental community is kind. And I would encourage us all to continue our kindness every day, in the office, out of the office. Be kind to one another. Make wise use of the time. There's a lot of good things that we can do. This is going to pass. Unfortunately, it's affected a lot of families, a lot of people, but it's going to pass, and it's going to give us opportunity to spend time with family and to spend time thinking about the things that are really important.
That's awesome. Really appreciate that. Yeah, you can apply that beyond dentistry to kind of everything that you're doing in your life and the people that you're around. So thank you for that. Thank you so much. I'd love to spend. I love the context that you bring. I'm sure you have so much experience that you could share, and I wish we had more time, but really want to thank you for taking the time today, for sitting with us and sharing your insights. Good luck during the sessions and the online. I look forward to getting to know you even better than I have already. And thank you so much. Thank you for that.
Thank you. Thanks for having me. I enjoyed it.
Not a problem. So those of you who are watching, if you have any questions, please feel free to put them in here, and we can follow up on that. If you like the content of this, or if there are ideas that you'd like us to continue talking about, please send those to us. We'd be happy to do that. If you like this information and want to do that, please go ahead and share it with other people who may benefit from the information that Dr. Bonner has provided with us. And then if you're looking for CE courses, go ahead and click on the sites and visit the sites, and we'll be talking to you soon. Thank you so much. Have a great day, and thank you, Dr. Bonner.
Thank you.